Do you want to know the answers to the top 4 most commonly asked questions about weight loss medications? Well, we're going to go over those today. My name is Dr. Lindsay Ogle, and I'm a board-certified family and obesity medicine physician, and I am the founder and physician at Missouri Metabolic Health, which is a fully remote telehealth clinic that serves patients all throughout the state of Missouri, and I focus on just this. I help manage excess weight and treat and prevent metabolic conditions through lifestyle optimization, weight management, and the utilization of medications when safe and appropriate. So today, like I said, we're going to go over those 4 most common questions that I hear either directly from my patients or from family members or I see on social media. And the first one is, are these medications safe? And the answer to that really depends on the person. And this is why you want to work with a physician whom you trust. And ideally, this is a primary care doctor who you have a long-standing relationship with and knows you very well, and or a physician who was trained in obesity medicine like myself. We have gone through additional training on how to appropriately utilize these medications in a safe and effective way. But if we're especially talking about the newer, most popular weight loss medications, the GLP-1 agonists, brand names of these medications that are FDA approved for weight management are Wegovy and Zepbound. These medications overall are very safe for most people. By far the most common complication or side effect is GI upset. And that can be nausea, upset stomach. Some people have vomiting, some people have constipation, some people have diarrhea. But overall, most of my patients, these symptoms are very mild, if at all present, and are short lasting. And we start at very low doses and then slowly work our way up as tolerated and as needed. If you were my patient and we started a medication and you were having side effects, we would talk through that. We would troubleshoot it. There are some lifestyle changes that we can make. And we can make sure that you are getting enough hydration, that you're getting enough fiber, that you're getting enough movement, that you're taking the medication at the right time of day. And we can work around that to minimize those side effects. We probably will not increase the dose if you're having side effects. We'll give your body some time to get used to the medication and then make adjustments later on. And there's a theoretical risk for increased medullary thyroid cancer. And this is really only seen in rat studies. It has not been proven in humans, but it is something that if you have a family history of medullary thyroid cancer, then you should avoid the GLP-1 agonists at this time. For all weight loss medications, we do not want to use these during pregnancy. And so we need a good plan to prevent pregnancy if you have that potential. We know that somebody who has obesity over the long span of their life, they are going to be at higher risk of diabetes, heart disease, certain types of cancers like breast and endometrial cancer, higher risk of stroke and blood clots, higher risk of osteoarthritis, early death. We know these things to be true. And so if we have a medication that is overall very well tolerated, then it makes sense for most people to at least try that medication under the supervision of a physician who is trained in this area to help manage their excess weight so that they can lower those risks and live a longer and healthier life. Second question, are they effective? That also depends. You want to make sure that you're on the right medication for you. And this is a very nuanced decision. Again, should be made by somebody who has experience in utilizing all of the medications that are used to treat excess weight, because there are many more than just the Wegovy and Zepbound. And so we have the possibility to find the one that works best for you. But again, I'm kind of focusing on the newer medications because this is what a lot of people are using right now. With Wegovy, on average, the weight loss that we see is 15% of somebody's body weight. So the exact amount of pounds or inches around the waist really depends on the starting point. But if we're looking just at weight, the studies show on average a person is going to lose 15% of that initial weight. And that can vary. Some people lose less, some people lose more, but that's the average. For Zepbound, the average is a little bit higher. It's 20%. Again, some people less, some people more, but on average 20%. So these are very effective medications. Our older medications, so some of those names are phentermine, Qsymia, Contrave. They average anywhere from 5 to 10, maybe 12% body weight for those, depending on which one. The third question I get a lot, or I see on social media, is do I qualify for the medications? And this is really, I think about this in two different ways. So one, medically, do you qualify? And then two, will your insurance cover it? And those are very different questions. So one, do you medically qualify? So to medically qualify for a weight loss medication, your BMI needs to be 30 or above, or BMI of 27 or above with a weight-related condition. Weight-related conditions may include, but are not limited to, diabetes or prediabetes, high cholesterol, high blood pressure, obstructive sleep apnea, fatty liver disease. Those are some examples that if you have those conditions, at least one of those conditions, along with a BMI of 27 or greater, then you would qualify medically. That does not mean that your insurance is going to cover the medication. As of right now, October 2024, insurance companies in America are not required to cover weight loss medications or anti-obesity medications. There are a lot of people who are lobbying for this required coverage, but right now that is not the case. So you need to check with your insurance agency to see if this is a benefit. If it is a benefit, then you will be able to get the medication, and your copay will vary depending on your insurance coverage. Some insurance requires what's called a prior authorization, or a PA, and that is something that your doctor or the doctor's office can fill out, and it's basically telling the insurance company why we think this is a good medication for you. And then other insurance policies, they just do not offer that as a benefit. They may then offer bariatric surgery. So that would be something to consider if you want to go down that route as far as a method to manage your excess weight or your diabetes. And many people don't know this, but if you get your health insurance through an employer, they are really the ones that determine if this is included in your health insurance package. So they are the ones to talk to about getting weight loss medications added as a benefit for maybe next year's cycle. So if you find out that it's not covered, then talk to your HR department, because this is something that if they offer it, a lot of their employees are going to want to stay with that company and continue that benefit long term. Number 4, very common question is, how long do I need to take the medication? As a lot of these answers are, it depends on the person, but right now for most people, these medications are considered long-term medications. And this makes sense. Obesity, excess weight, is a chronic medical condition. There is dysregulation in how your body is processing and metabolizing your food intake and regulating your fat stores. And hormones are often dysregulated in obesity. Hormones like insulin and leptin and cortisol. These are all factors that have led to obesity and maintained it long term. So it makes sense that we are going to need a long-term treatment. Now, it is quite possible that we find out down the line there are a subset of people who need the medication for a few years, and during that time while they're on the medication, their body kind of resets itself, gets used to this new set point, and they may be able to wean off of the medication slowly. I do anticipate this being a possibility for many people. Not everybody. This is, again, very individualized. But I do want to say that this is not a short-term solution. I do not recommend taking weight loss medications for a month or 3 months to get ready for an event. This is a treatment for a medical condition to improve your health in a safe way long term. So it's really important to have that mindset prior to starting a anti-obesity medication. And if for whatever reason you do stop the medication, you will probably notice that your hunger returns, not feeling as full as you used to, your portions start to increase again, weight starts to gain back. Nothing has gone wrong here. The medication that was working was taken away, again, for whatever reason. And if you are able to, you can always restart the medication at a later date. That is fine. Just make sure you start it at the lowest dose and then slowly work your way up again to avoid side effects. And always work with your obesity medicine physician or primary care doctor who has experience in managing excess weight. This is something that I am very passionate about. I love to help patients with. My patients are able to safely lose weight, regain their energy, their mobility. They are able to do the things that they love, hiking, playing sports, playing with their kids, and just really enjoy their life again. And I am so happy to be a part of that process. If you live in Missouri, please check out MissouriMetabolicHealth.com. I would love to serve you there. If you do not, I still recommend that you subscribe to my channel, and I will continue to share my medical information and knowledge and experience with you. And I look forward to talking to you next week.